Okay, I'm gonna do a video on how to present these plans. First, I just kind of want to show a couple of things. Medicare and U-Book right here. This is very good for people that are unsure about these Medicare Advantage plans. We use this part to just explain what Part A is, inpatient care, Part B, doctors, the part they pay $164.90 a month for, Part D, prescription coverage. And then we love this page. You got two ways you can go, two roads, so to speak, the traditional, the Part C route. Traditional Medicare A and B, red, white, and blue card, pays 80%. You add a D for an extra premium, add a secondary, supplemental, or Medigap for an extra premium. Costs more to do this every month. Everything you add is a separate plan, like dental, supplemental D. These usually have deductibles attached to them. Or Part C, everything's in one plan. You get your A, your B, your D through a private company like Humana, United. And oftentimes people will ask, well, I don't know if I've heard good things about those Advantage plans, so I turned to Section 4, explained to them a Medicare Advantage is just another way to get your Medicare A and B. Now this is coming from Medicare, it's not an insurance company, it's a non-biased view. If I'm selling them a PPO because they have an HMO, I'm gonna go over and read Health Maintenance Organization, HMO, can I get my health care from any doctor, other healthcare hospital, or provider? No. You generally must get your care and services from doctors and other healthcare providers or hospitals in the plan's network. So then I'm going to flip over to PPO. Can I get my health care from any doctor or other healthcare provider or hospital? Yes. So you have more flexibility. So if I'm trying to sell them a PPO, I usually point that out. In the back of this book, you have different plans. You have a prescription drug plan section, and it's got the company and it's got the plan, if you know how to look for them. S5601 is the Aetna Silver Script, and then the 3-digit number tells you how much the premium is next year, if there's a deductible. Okay. Most Medicare prescription drug plans have a deductible. If it's an Advantage plan, similar thing. Okay. You see the numbers, and then you just add the 3 digits. It tells you the county, the plan. Okay. This is very handy to use when you're looking at a card like a Humana card. The number is right about here. A lot of times it tells what plan it is. Of course, you can look up here, but all the Humanas are down here. So you can look in the back of this. So you kind of know what they have a lot of times. Now, sometimes they'll give you their card, but it doesn't mean that's what they have. With United, their card, their plan number is right here. It starts with an H. Okay, like for example, right here, H87-68009. And you just learned that's their PPO. So you kind of know what they have as far as that. With Medicare, it's got their Medicare number, their A date, their B date. You need that information when you fill the application out. Now, Humana has this cheat sheet that we can get for everybody, if not a physical, but online. It's hard to really see unless you angle, but it's got all the plans. It tells you what they are up here, like PPO, HMO, give back plans, PFFS, and it'll actually give you the premium. Real small print there. I can see copays, deductibles, the counties they're offered in, okay? And so that's handy. So let me show you. This is the Clarity Guide. If you do this, you cover pretty much all your bases. First, it's got the 2 paths like I showed you in the Medicare and ebook. If they have a Medicare Advantage plan, you really don't have to go through this part, but if they don't, you can explain the 2 different ways to go. Explain the annual enrollment period we're in, October 15th through December 7th, they're eligible, okay? And these 10 points are really key. If you hit all these, you're being compliant. You must pay your Part B. An Advantage plan covers all the services of Medicare. Joining this plan may affect your current coverage if you have existing employer coverage or health care. It's best to use network providers. You may qualify for financial assistance. You may have a late enrollment penalty if you didn't sign up when you were first eligible. This is not a Medicare supplement. Medicare supplements are different. Use your ID card, not your Medicare card. You have the same protections under Medicare, as well as a max out of pocket. So if you cover all those, you really cover all your bases. And then on the prescription, very simple to just go over how the Part D works. Explain the deductible stage. You can almost read just like it is on the page here. Member pays 100% until the plan deductible is reached. Plan typically pays 0. Initial coverage stage, member pays a copay or coinsurance. Plan pays the balance until the total drug costs reach $5,030. If that happens, member pays 25% of the drug costs. Plan pays 75%. Until a total out-of-pocket of $8,000. If that happens, member pays 0. Plan pays the rest through the year. All plans have different cost containment guidelines. Pharmacy networks, drug lists, or formularies, lists of covered drugs. You can always offer to look their meds up to be sure they're covered. That's important to do. Different tiers, different ways to contain costs. Try different drugs before they approve the more expensive ones, step therapy, quantity limits, prior auth rules. Just explain that. It's good to hit those, okay? And then when you get into the benefit summary, you can say, now this particular plan is one put out by Humana. You want to explain the star rating, very important. CMS rates these plans on an overall star rating, 1 being a poor grade, 5 being excellent. This plan has an overall 4.5 star rating. This is the PPO CSNP for Northwest Arkansas. Okay, doesn't hurt to explain what a PPO is, Preferred Provider Organization. And then of course with these Humana plans, in addition to the white plastic card they get, okay, they get a green visa. Depending on the plan, depends on the wallet that visa offers. For example, this one offers the Healthy Options Allowance, which this card can be used to buy food, groceries, over-the-counter products, pay their rent, pay utilities, household supplies, pet assistance, pest control. Some plans, the card is only a flex card. It's only for dental, eye exams, optical, hearing aids for in-network providers. Some plans, it's just strictly a quarterly over-the-counter allowance. When you get in here, there's a summary of how the plan works and the copays. Humana calls it a benefits at a glance. United calls it a benefits highlight. And you go through the copays, the monthly cost, 0, the max out of pocket, and you get the buy-in from the member, you know. Daily hospital copay that they're responsible for covers everything built into that. Doctor's fees, room fees, everything into that copay. And then after day 5, it goes to 0. White is out-of-network cost share. Gray is in-network cost share. Extra services, the monthly allowance they get on the prepaid card. Dental, optical, fitness membership. How the drug plan works. The tiers and what they pay. How they pay no copay for 90-day mail pharmacy for tier 1 and 2. And you've already explained the gap stage, so you have to go back over that. And then you get into the benefit summary. And you must cover all this that you see right here. And that point all the way to the back here, you've done a compliant presentation.